Good afternoon, good morning, good evening, everybody. Thank you so much for joining us today on another session of Reconnect Academy Learning from Women Leaders Around the World series. My name is Andrea, and today I am very happy to introduce Dr. Sajita Setia. She is a clinical biochemist and pharmaceutical physician certified by King's College in London. She is the founder of Transform Medical Communications and Transforming Life, a We Connect International certified company based in New Zealand. Transforming Life is a division of Transform Medical Communications, and it is a digital platform to boost mental health and emotional well-being using scientific and proven metacognitive insights, knowledge, and practices. We are really happy to have you, Sajita, here on this webinar. We hope that all of you become more aware of using change management to build resilience and positivity, innovation in crisis, and also learn how to train the unconscious mind and how to bend a negative reality into a positive affirmation in life. I just want to remind everybody that that you are in listen only mode. That means that you are on mute. If you have questions, please type them down on the Q&A chat box that you will find at the right side of your screen on the GoToWebinar control panel. The webinar is being recorded and it will be available after today's session. It will be emailed to all of you, but also it will be available on our YouTube channel. If you don't follow us on YouTube, please find us under the name of We Connect International. Thank you, Sajita, for being here with us today. Over to you.
Thank you, Andrea, for the lovely introduction. Hello, everybody. It is my pleasure to be here, and I'm really grateful to Reconnect for giving me this opportunity. So a bit about myself, although Andrea has introduced me very well. I am a medical and health education expert and a pharmaceutical physician. Before founding Transform Medical Communications in New Zealand, I was the head of medical affairs for a pharmaceutical company in Singapore. I have worked in healthcare, in medical education, and in corporate sector for over 15 years. But my passion and my enthusiasm is basically in mental health. And with COVID crisis, I felt that there's no better time to start transforming life. And my vision is to empower youth with everlasting, lifelong positive mindset, motivation, and resilience that imparts them with success for life and protects them from high-risk behavior. I'm really happy and glad to have my colleague, Dr. Michelle Tichy, here as well. And I would let her introduce herself.
Hi, everyone. I'm Dr. Michelle Tichy. I am the Education Director of Transforming Life and Sajita's partner. I hold a doctorate in educational psychology. I'm also a trained positive psychologist who specializes both in educational psychology and positive psychology around social and developmental issues. I work with and train teachers in the United States. I am also an expert on supporting neurodiverse students, including students with anxiety and ADHD, as well as highly sensitive and gifted children. My heart-centered commitment is to create access to holistic and authentic psychoeducational opportunities, and my work integrates contemplative practices as well as social and ecological justice. And I'm very happy to be here supporting Dr. Sajita tonight. Thank you.
Thanks, Michelle. So before we begin, I wanted to put forward two scenarios of two fictitious characters. One is Sally, and we can relate to Sally at many times in our lives. Sally is a graphic designer. She works in a farm. She's a mom of 2 kids, but she constantly fears for her job and income stability. And there is an influx of a lot of Sallys being created with the COVID-19 pandemic. And this Sally resides in all of us at different times. She is prone for constant arguments and conflicts with her partner. Eventually, she sees a mental health specialist and she's diagnosed with anxiety and depression. Now, there is another fictitious character here. Her name is Anita, that also resides in all of us. And she also has similar job. She also has very similar family support and also the socioeconomic background. She's also prone for being laid off, but she tries not to think about it too much. Instead, she fills her life with gratitude, hope, and optimism. In fact, spending quality bonding time with her partner and kids helps her to calm her mind. Now, these two characters, they are in all of us at different times, and our feelings vary depending on what we think at one moment, although the circumstances are the same. So, what really predicts how do we feel and how do we perform in life in general, in our professional life, in our personal life? There are a lot of factors. There are genetic factors, we know that depression and anxiety and a lot of mental health disorders, they run in families. There are personality traits. There are some people who are sort of born positive. They have an optimistic trait. And of course, there are socio-environmental factors based on how kids were treated and raised and what kind of role models we were exposed to. But everything together, it boils down at the end of the day to one thing, and that is our explanatory style, which means what we talk to ourselves, our self-talk. So when I'm faced with any life situation, what do I tell myself? And there are times during the same day when I'm more positive, and there are times when I am sort of negative, and they predict my feelings. Most often, we tend to blame governments, people around us, circumstances, but actually, it is basically our self-talk that determines what we feel. And it's not just what we feel, it determines our success in life, it determines our mental health, and very surprisingly, it also determines our physical health. So powerful. So let's try to understand what I mean by this explanatory style. So when we are exposed to any adversity, any life situation, we have a cascade of thoughts going on. And based on our thinking process, our thoughts, we create our reality. We create a belief around in our mind, and based on that belief, our life follows. But all that is just created by our thinking process. So in summary, explanatory style or self-talk is one's thinking process around a situation. And that brings down to the power of thoughts. But before that, I would like to share with you the mind-body problem, which is indeed a big problem in the philosophy of psychology. The reason is because, unfortunately, there's no consensus to this problem. So in psychology, mind refers to the emotional domain, and brain and body refer to the physical domain. So most of the times, mind stands for human consciousness, and dualism, which basically separates mind from body, because mind represents consciousness or thoughts, which is not physical, which cannot be seen. But the body and brain, they are physical. So dualism, according to the theory of dualism, mind is distinct from body, and mind represents consciousness, which cannot be seen. But there is a wider accepted theory, which is materialism, and which relates to evidence-based medicines. Whatever you cannot see does not exist. And sort of materialism claims that it solves the mind-body problem, but actually it doesn't. The reason is we know that thoughts impact, they have a big impact on our lifestyle, on our body, on our physical health. But unfortunately, the definition of thoughts impacting our relationships and physical health, and of course, mental health, is very ambiguous, and it's all clubbed under spirituality, which is not widely discussed in Western medicine. When I went to study medicine, that was like almost 20 years back, nobody really told me about the power of mind and the unconscious mind. We start with anatomy, we start with physiology, something which you can see, something which is proven. But lately, there is a lot going on. A lot of evidence is emerging, and well-established evidence that thoughts indeed impact a lot of things around us, and they may impact almost everything that we believe in and we witness and we see and we feel. And there was a biopsychosocial model for healthcare, which is a very robust and holistic model. But based on the evidence that has been emerging, the DSM-5, which basically classifies a lot of mental health disorders, has even included another diagnosis for thoughts impacting the physical health. And now we are paying a lot of attention in clinical practice on biopsychosocial spiritual model for healthcare, where we also introduce a spiritual domain. But of course, spirituality is not religion. Spirituality is different. It's basically how thoughts have a very complicated interplay in our health, in our relationships, and actually in every domain of life. So with this, me and Michelle being positive psychology enthusiasts, and she is a positive psychologist. What is really positive psychology? Positive psychology says, and it plays on the principle that happiness is not something that just happens. It is a condition that must be cultivated and defended individually. We pay a lot of attention on how we look, how we interact, a lot of things outside, what is around us, how stable is the government, is the country, how stable is the environment. But unfortunately, we forget to pay attention on what actually goes inside our mind. And a lot of the problems, I would say majority of the problems, are created by our mind. And the best part is our mind also has the solution to all the problems. If rather than focusing outside, we focus within us, our life would be far more easier and simple. And I also wanted to introduce to you Dr. Martin Seligman, who's the father of modern positive psychology. And a lot we would be talking today about learned optimism, because we saw that our explanatory style, our self-talk, has such a big impact on everything around us. And optimism can be cultivated, it can be learned. And Dr. Seligman recommends to introduce learned optimism right from childhood as a preventive strategy, not just for prevention of mental illness, because it, it definitely immunizes an individual against depression and anxiety in life, but it also helps with the physical health. And we would see a lot more on this aspect in the subsequent slides. So before we go into learned optimism, I just wanted to share with you the current mental health crisis, which I'm sure you're very well aware. This crisis existed much before COVID-19 pandemic. It has definitely been very rapidly escalated. Unfortunately, it does not really receive the attention that it should. So the stats before COVID-19 pandemic, it's like at least one person commits suicide every 40 seconds. And even if we double the amount of funding that is currently available, we cannot reduce the burden of mental disorders by even half. We cannot reduce and we cannot prevent. So looking into innovative strategies where everybody takes ownership over their thoughts, emotions, feelings, and takes active part in their mental health is really crucial. At the same time, we know that there's a lack of well-trained clinical staff and a lot of stigma, especially in the emerging markets and low and middle income countries. And also in the ethnic minorities of most Western countries, we see a lot of stigma talking about mental health. But why is there stigma talking about something that predicts everything in our life, from our success to our performance? It's very complicated, and I don't intend to go into this topic, but it's also a time where a lot is happening behind the scene. The reduced productivity and collapsing economies are not just the direct impact of COVID-19 pandemic. There's also a lot of indirect effect which is caused by excessive worries and negative reactions to everything around us. And they do have a big impact in reducing productivity, creating further low self-esteem and morale, which also are worsening the economic crisis. So what happens when we stay in a constant state of excessive worries, which is happening right now? Uh, and our sympathetic nervous system, which is the fight and fright, the nervous system, which is active when we are anxious. So little bit anxiety is good because it helps us to drive our work and do it. But when it becomes excessive, there is release of stress hormones, and constant excessive release is responsible for a lot of chronic inflammation, for autoimmune disorders, for chronic inflammatory disorders that we often hear. And a lot is attributed to just the word stress. And this long-term exposure leads to a lot of health conditions, not just mental health, but a lot of physical health conditions. It's not unusual to see a lot of patients visiting GP clinics, and talking about, long headaches, which are not really attributed to any cause, or diarrhea, gastrointestinal symptoms, chronic fatigue, myalgia, which definitely affects productivity. And many a times they are exposed to very expensive diagnostics and treatments, but the cause is just in their minds. So it could be a subtle level of undiagnosed anxiety, or low mood, which is actually causing the problem. And it's not just lack of diagnosis. What happens really on an individual level is that it creates an inattentional state of mind. There is often failure of cognitive control. It comes as impulsive behavior at times, in anger, or insomnia. And of course there is decreased productivity and focus, which leads to further irrational choices and decision making. And we have seen that domestic abuse has increased, child abuse has increased, homelessness has increased, which is not many times related to the direct impact that we have seen with COVID-19 pandemic, but it's the indirect impact because of excessive worry and anxieties. And here I would let Dr. Michelle talk about it, because the most vulnerable period of our lives are the youth years, especially time, of our age span less than 25 years, because the rational part of the brain is not fully developed till that time.
Hi, everyone again. So during our adolescence period, from right before when we hit puberty all the way through adolescence, we become extremely vulnerable to mental health disorders and drug and alcohol abuse, and doing what we call high risk health behaviors, and also getting really easily triggered into mental health issues. Some of the things that contribute to this are competitive environments, family expectations, negative influences from social media, and peer pressure. And because during the youth years, where this is a high risk period just systemically for mental health problems, more than 70% of the major mental health disorders get diagnosed during adolescence. So this is something we need to keep in mind. Mental health disorders and suicide are a very, very real problem among our youth population. Half of all mental health disorders start by the mid-teens. suicide is still one of the leading causes of death in teens, and there's been a huge alarming increase in teen suicide over the last 10 years, and it's only gotten worse during 2020. Substance use and drug dependence are definitely major issues with our youth. We're living in a world where danger lurks at every step. Greedy drug dealers see mentally and emotionally vulnerable children and youth, and they seize upon those vulnerabilities. Alcohol, drugs, as well as overall stress are poisonous to teens and young adults' developing brains, and impact learning, memory, and cognition, inevitably resulting in irrational decision making. And because the prefrontal cortex isn't even developed until they're 25, they don't have all of the capacities to make rational decisions. Thank you, Sajita.
No worries. Yeah. So, yeah, I'll let
I
Michelle
got
continue. Yes.
intrinsic motivation in youth imparts them with success for life. And so we all recognize that there's intrinsic and extrinsic motivation in ourselves. The research in motivation tells us that the more internalized someone's motivation is, the better off they are. So motivation, willpower, and self-love are not things that can be forced. They are very complicated psychological phenomenon that are related to a variety of biological, social, psychological, and spiritual exposures. Tried and true coaching based on positive psychology principles can help to train the mind to consciously and frequently deep dive into unconscious self-limiting beliefs, and in the end transform the persistent negative thinking into more positive decision-making skills that can then unleash the potential and prevent it. It acts as a protective mechanism to reduce high risk activities. Empowerment through exciting and engaging brain stimulation is another way that we can ignite intrinsic motivation. This allows us to impart willpower, self-confidence, along with a sense of purpose and direction in someone's life. During the youth years, people are blessed with a huge amount of agility. We have a lot of neurologic flexibility at this age, so it's much easier to shape a youth's thinking style and help them to learn to stay focused, develop deeper resilience, self-confidence, and really embrace a positive mindset as well as a very healthy lifestyle.
Yeah. Thank you.
Thank you.
So, we discussed the problem and we also discussed the solution. And there's a lot going on with COVID-19, with everybody saying what is really happening in the world. But looking at the transformational innovation aspect, maybe COVID-19 is indeed providing us an opportunity for social transformation. Things do get worse before they get better. And it is probably the time to change the mental stress into mental well-being by learning and accepting the skill sets. It's also the time to accept that there were deeper mental health problems much before COVID-19 and start the trainings in schools and workplaces and institutions as a priority. And why is this so critical when we look at really well designed studies from good evidence? There are a lot of benefits of developing an optimistic, a positive self talk, consistent positive self talk. Those people who are, I'm talking about realistic optimism, of course, when we have a connection and with the reality. Um, a lot has been seen in terms of greater rewards in life in terms of finishing, university, generating higher income, having a better job satisfaction, having successful relationships, also successful relationships with our children and not just partner, and also resilience to loneliness. Generally, people who think positive, they are more likely to accept healthy activities. They're likely to smoke less. They're likely to exercise more. And even if there's any adversity in life, for example, for some reason they develop a dangerous, physical illness, for example, let's say cancer, they are able to have good, better recovery from that adversity or illness. In general, they develop less physical illnesses. They have much better mental health, and they have better recovery for any physical illness or situation in life. And here's the good news. The good news is optimism can be learned and it can be inculcated. It's not a debate whether the glass is half full or half empty. The point here is that the glass is refillable. No matter what is the age, the glass is refillable. Optimism can be learned. It is much easier if it is introduced much early in life, especially in the youth years, because these years are very delicate and vulnerable period. There are drug dealers eyeing the stress in our kids and the young population. But we can be smarter by rather going there and empowering them with the skill sets to manage mental stress. So here we are going to discuss some of the strategies to help you transform your thinking and definitely transform your life. The first step is, of course, mindfulness, which you have heard, and it is a very powerful tool. Mindfulness basically refers to just paying attention to your thoughts, paying attention. But once I am conscious of what I'm thinking, the way to transform your thinking and inculcate a positive self-talk or an explanatory style is to go into metacognition, which refers to thinking about thinking. So here we pay conscious attention to our thoughts. You see, what am I thinking? Was I feeling this? Am I feeling angry? Am I feeling bad? Am I feeling sad? Okay, let me go back. What am I thinking? This is what I was thinking. What kind of thinking is it? Is there any way I can change it? Yes, I can change it. We always have a choice. Happiness is a choice. Happiness is free. There is absolutely no price tag to happiness. Happiness is not generated by buying expensive clothes or getting a good raise in our income. It is always there, free of cost within us. It is never outside. It is outside if you take it for a very temporary period. If you're trying to find permanent happiness, it is within you. It can be easily found through mindfulness and metacognition. So let's look at the ABC of problems in life. I'm sure many of you are like, what? Really? So simple? Yes, let's try to understand. So what happens when there's an adversity? All these are adversities, you see. Something small happens, but I have a cascade of all the automatic negative thinking. And all these thoughts, they are transitory events. They are not reality, but to us, they look like reality. So based on the adversity, which is A, our thought process starts a belief that this is what is life. This is what is situation. And these thoughts or the thought process, which are our beliefs, which are created due to the thought process, they in turn dictate our moods and feelings or the consequences. So here's an adversity. There is a problem. It could be a simple problem. It could be my child getting an F grade or reacting with me, answering back, being under peer pressure. It could be my boss not so nice. It could be a physical illness that I have got. It could be anything. Okay, some people may not even consider that as an adversity, but the same situation other people would call, oh my God. And depending on how I am feeling, I may even consider sometimes the same situation as adversity and I may not consider. So they form our beliefs. No, I cannot do that. It's a negative belief based on negative self-talk, or this is a dangerous situation for me. Oh my God, my life is ruined. All the negative self-talk. What do they create? consequences, feelings which are generated by our own thinking style. Nobody's imposing them. I am thinking them. But with negative self-talk, it leads to low self-esteem, confusion, anger, sadness. These are all the consequences of negative self-talk created by my mind. So there is a terminology called automatic negative thoughts. In psychology, more commonly they are called as negative automatic thoughts or NATs. But here for representation, we are calling them as ants. So these are the ants around your mind, all the negative thinking, the persistent negative thinking, which is responsible for most of the depression and anxiety that we see in. They are due to all the negatively framed interpretation. So let's zoom into ants. You see, this is how I visualize. The problem is we are not able to catch the ants until it's too late. We are just so lost in the negative thinking. It goes on for hours, days, months, and whatnot. And a lot of wrong beliefs are formed around us, our self-limiting beliefs about people around us, about our job, about relationships. But they all start with the first chain of ants around our head. So how do we deal with ants? Where's the ant spray? We discuss about adversity, beliefs, and consequences, and the negative thinking style or the negative self-talk leading to, wrong feelings. And then we bring in ant spray. Once we are mindful of what we are thinking, you see, we bring an ant spray where we check our thinking process. It's actually much very hard in the beginning if you don't consistently meditate to be aware of what you're thinking. That is true. But it is not so hard to be aware of what you're feeling. It is never hard. We always know what we are feeling. So instead of blaming everybody, the situation, or just going into a really, really bad mood, just go back. Take some time to reflect. Stop doing what you're doing. You can give yourself 5 minutes in 24 hours. You deserve that much self-compassion and self-love. Go back. Ask yourself, what was I thinking? Why am I feeling like that? And then check your thinking style and then dispute it. So this is the ant spray when I start disputing through positive personal dialogues. So I think about my thinking based on what I am feeling. I catch all those thoughts going on around me and I start to dispute them, the D. And you would see instant boost in energy, change in mood. Of course, the more you give the food to your mind, the food of positive thinking or disputing the negative thinking, you would see how the energization, the positive energy spreads through. It's not just within you, it has spread to your team, it has spread to your relationships, it has spread to your family. So we discussed two critical aspects. First is the thinking about thinking, where we pay attention to our thinking and especially to our negative dialogues, And then once we have identified the negative dialogues, there are a lot of strategies, and we would have a small workshop on meditation where we would also see how we can change this, train our unconscious mind, because many times it's so deep rooted. It's through the years, how we were raised, how we were trained, and we find it so hard to do it. But of course, there are always options. And once we find we dispute them through positive personal dialogues, which is basically a conscious effort to eliminate negative thoughts. And then we see how it transforms our efficiency, our mind. And of course, the success in life is all related to these two powerful components of the ant spray, which is PAT, thinking about thinking, and PPD, positive personal dialogues. So this is just an example we created, and this was in me. This is in my mind, during lockdown. How will I work from home? I have businesses to run. Clients are chasing me. Kids have no school. It's virtual schooling. How will I manage everything? But then once I identify, I am creating this reality that I cannot manage. Probably I can. Maybe it's giving me an opportunity to spend more time with my kids. And once we see that we have an optimistic style, it's contagious. It passes to your family. You would see the collaboration and the help that you get, because everybody loves positive energy. Everybody feels so happy with positive energy. These are some other ants, about the social connect, gaining weight, without going to gym or swimming. But there are always options. You can do yoga, and many countries, most of the countries, they did allow, a workout in nature. So it can give us new opportunities with crisis STEM opportunities. This is the biggest problem right now. Yes, jobs are at risk, but the worries and anxieties that are created by repeated thinking of what would happen to my finances, it just lowers the productivity. And then there are positive options. You see, the biggest innovations have happened during the time of economic crisis. There are people who are struggling, but there are also people who are doing very, very well, even boosting their business. What's the difference? The difference is what they are thinking right now. And there are options. If you have the good wisdom and decision power, you would see that there are always options. Doors are always open. It's just the door of the mind that is closed. And relationships, so many relationship problems are emerging among partners, among parents and kids. But then it's also a time to show the true love by being there, turning the crisis into opportunity, using forgiveness. Everybody is under pressure, but we will not allow this to affect our relationships. Rather, use this time to build even better relationships. It's all within us. The anxiety of actually catching the infection, can we do anything about it by being worried all the time? Yes, we need to take all the precautions. You need to wear masks. We need to use all the PPEs and the sanitizer, definitely. But we don't need the worries that I'm going to catch the infection, I'm going to die, what would happen? Rather, stay positive. Yes, I'm following all the precautions. I'm trying to stay away from the ants. We follow the precautions, but we forget to stay away from the ants in our mind. So this was just some summary on some mental health boosting strategies that you can use in your day-to-day lives. Please share your feedback, after the webinar. Try in your life and see the positive energy that it brings within you, around you. There are plenty of resources on our website. There are a lot of visuals, a lot of videos. I would later share the link with you. You can go anytime and visit them. And of course, contact us if you need further information. So now it's time to train the unconscious mind. So we have a lot of brain waves. We have alpha, beta, theta, delta, and whatnot. And there are a lot of claims that this happens or that happens, and we need to go into delta mode. Meditation is very simple. It is not complicated. And, when you are thinking too much, especially individuals who are prone for depression, anxiety, they have more of beta waves. And with relaxation, we can bring in alpha waves. Theta, delta, and everything. With hypnotherapy, they say it's theta, but it's really, really not common, and very experienced hypnotherapists can create that stage. I think at this time, we just need to relax our minds, accept it, because its happiness is always there. We just have to allow it to emerge. It's all within us. Peace is within us, happiness is within us. It's just that we are blocking it. So we would have a very short meditation exercise before we take up the questions. Relax. You can close your eyes. We would start now. After some practice, you can even do meditation with your eyes open. You can even do while you're at work, but right now, just close your eyes. It's to block the visual stimulus. Pay attention to this moment. And if there are a lot of thoughts going on in your mind, just pay attention to your breath, to focus, relax. You are taking in the positive energy. The air that is going on inside you is bringing positivity inside you. Now fill this moment with gratitude. Ask yourself, are you able to breathe clean air? Do you have roof on your head? Do you have food on your plate? If yes, you are among the top 95% people in this world. Okay? If you are really concerned about negativity from any individual, or if you're concerned about worries related to your future, visualize immense positivity radiating out from you. Just visualize. Get lost in the gratitude. We are very lucky. We can breathe clean air. We have food to eat. And now visualize the positivity radiating out from you. You can visualize it in any color, the light falling on you from the universe, and you are radiating it out. This energy is always around you. We just have to accept it. We accept it by not judging ourselves, by not judging anybody. We are just radiating positivity. We do not allow any wrong beliefs to form. Judgments lead to wrong beliefs. And I'm not judging myself. I'm not judging anybody. Everybody is accurate in their own way. Now I use the power of forgiveness. I accept to forgive myself, and I accept to forgive others. This is one of the most important powers in self-healing, in healing from any trauma in the past. With this power of forgiveness, I allow my birthright of peace and happiness to emerge. If any past trauma comes through my mind, I tell myself that I am a different person now. I have changed from being a caterpillar to butterfly, and I am beautiful like a butterfly. I do not have to go back and think to my life as a caterpillar, because I am a butterfly now who can fly. And I feel that energy coming out. I feel relaxed. I feel the power and the light falling on me. I feel it's healing my body and my mind. Once again, I allow self-compassion, self-love, and I allow forgiveness for myself and for everybody. With this self-healing, my mind is clear and clean. I remove the negativity of the past and worries of the future. When the caterpillar thinks it's the end of the world, it becomes a butterfly. My future is bright and positive. I will innovate and transform like a caterpillar due to this time. Okay, you can open your eyes now. So that was very quick, but generally try to deep dive, and you can do it much often. And there are many other meditation strategies. For me, what really works well is the early morning time, because my body clock is in line with my, the stress and the hormones are really coiled at that time, at the early morning hours. It's much easier to train your unconscious mind, because it's the transition from unconscious to unconscious, thoughts and feelings in the morning. But anytime you wake up, just try this before you go to bed. Anytime you feel heavy, and after you have meditated, it's very important to transform your mind and the reality with feelings of novelty. So feelings of novelty, basically, you feel different, right? When you dispute the negative thinking. So open your eyes, grab your notebook and pen, write down 3 worries that bother you the most. You can do this after the webinar. If you have time, you can do it now. After you write your worries, write why do you feel blessed in life. When we are really, really worried and, a lot of things are going on, unfortunately, we do not feel why we are blessed. We just are trapped in that vicious cycle of feeling, I'm the victim, I'm the victim. But transform that feeling into why am I blessed in life? And pick up each worry. after meditation and evaluate them with a feeling of novelty. Write down your points on how you dispute them. You are your own superhero. So dispute your worries and problems. Tell yourself, no, this is not the case. This is not the reality. Why am I thinking that? Why do we think that things are going the wrong way? They can really go the right way as well, or they can really turn out great for us. And repeat this personal positive dialogue several times. And when you feel low, go back to your gratitude journal or your diary, your feelings of novelty diary, and read them. And if you feel it's not confidential, please share with your family, because positivity spreads. Share with your children, share with your partner, even with your extended family. If you feel people are feeling low, share it with them, because it's infectious. When you try to cheer others, the first beneficiary is you. When we forgive others, the first beneficiary is ourselves. There is no point keeping feelings of anger within us about anybody, because a lot that we see and hear in media is not true. And we just lose our energy. Try to stay away from a lot of negative news. Of course, you need to know what's happening around you, but just how much you need to know, that's all. You can create your own world, your own positive world, and stay there happy and contented. I think, yeah, this is the end of the webinar. Michelle, you have anything else to share? Thank you so
No,
much for the opportunity.
I
Yeah, go on.
I was just going to say, we would very much love to answer your questions and offer to you any support in the little bit of time we have left.
Yeah, sure. So this is about us, our organization. We focus on boosting mental health and emotional well-being across all the age groups, although our focus is on youth and their families. We also have a free Facebook private group for parents. It's called Support Group for Parents of Teens and Preteens. You can contact us if you need any help with empowering your child, your emerging adult, teens, preteens, because this is the time where mental health problems start. And this is the time where there is a lot of peer pressure and curiosity about drugs, alcohol, and we provide very, very holistic and comprehensive trainings that trains them not only, on staying away from brain poison, but actually sort of trains them in becoming motivational coaches themselves. We also provide certification for the trainings and for corporates and organizations. If you want to connect with us for your employee training to boost their productivity, we are here. You can email us. These are our details, and this is the website. So we are open to questions now. Do we have any questions? I will.
Yes, please, to all our attendees, this is the moment when you can write your questions. So at the right hand of the GoToWebinar control panel, you will find a tab that says questions. Please send your questions written down there so that Sajita and Michelle can answer your questions. Let me see. I shared, Sajita, the link that you shared with me. Do you want to explain a little bit more about the link?
Yeah, so we are rolling out teen empowerment, youth empowerment programs. We are giving you an opportunity to connect with us. We have shared our calendar with you for a free strategy call in case you want to you're looking at empowering your children or yourself or your teams. So please connect with us. And there are a lot of resources available on our website. We provide very holistic programs based for 6 weeks, for 12 weeks, based on your convenience. And we also provide the opportunity for testimonials and also peer support for the youth. So those who participate in our trainings, they have the opportunity to in turn start a career or for peer-to-peer counseling, and stay connected with us in starting this global movement for helping people around us. Yeah.
Great. Well, you're receiving a lot of compliments. I have a question here for you. For our audience of women business enterprises, can you share a few ideas about how employers can help employees deal with problems related to stress, and especially right now with the pandemic? What can employers do to help their employees?
Yeah, I think that's a very good question. Thanks for asking. And we share a lot about how the anxiety and the stress related to infection and what's all going in the world right now is leading to further reduced productivity. It is very important to take proactive effort in arranging some training for them on boosting mental health, because we know it's related to performance, productivity, hope in life in general, and also keep them safe from mental health problems that have just been highly precipitated with COVID-19 pandemic, protect their relationship with their children and partners. So I think it is a very good thought from employers. Many employers have started trainings already. It can be group trainings, and especially if you feel that there is a high risk individual, we should definitely consider that. There are drug dealers also eyeing the stress in young people. So please keep that in mind. It's become increasingly common for that, and especially when they cannot sell openly, a lot is going on online. And keep them away, ask them, in our trainings, keep away from the negative news. It is infectious, just like positive energy is infectious, negative energy is infectious. And you would see after the productivity trainings about the mental health boosting trainings, you will definitely see an improvement in their productivity. It's just the accurate decision and wisdom on what to do. And definitely it impacts our work. When we are sad, we feel low frequently, it affects our performance. And we see that within us all the time. Yeah. So thanks for checking. I hope that answers your question.
Yes.
Thank you.
I have another. This is such a serious problem right now. This has been excellent, and I hope it was well attended. Thank you, Kathy, for your comment. Can you share, Sajita, a little bit more about what services do you offer companies? Small, medium, large. How can our audience, connect with you so that what type of things you can offer companies of any size?
Yeah, so this is about us. It's on our website. You can visit. Can you see my screen on here?
Yes.
Yep. So you can visit our website.
Yes,
This is about us. Yeah, we are a digital platform and coaching center. We boost mental health and emotional well-being using scientific and proven metacognitive insights, knowledge, and practices. And what is our vision and mission? So our vision is, of course, to boost productivity, efficiency, happiness, and inner peace, but at the same time also prevent mental health illness and substance abuse, because once they start, it's not that they cannot be treated. We know that the recovery rates are not so great, especially for substance abuse. So it is always best to prevent them. But once you see that there's a particular colleague or family member who needs help, please go and seek help ASAP, especially for your teenagers. You see, the American Academy of Pediatrics and most other international guidelines, they recommend screening teenagers at least once every year for depression. Unfortunately, it is not happening the way it's recommended. So if you have children who are young, ask them regularly, if they feel sad, and please take all these things seriously, because once these problems start, it is difficult to go back. and seek help ASAP, especially if you see any self-harm behavior among your employees, among your colleagues. You can contact us anytime if you want group trainings or even one-on-one trainings. We are very happy to help. And we aim to achieve our vision through our mission of launching empowerment courses. So we have a course scheduled for 6 weeks, for 12 weeks, also for corporates. If you are keen, please connect with us and we can really tailor it to match to your requirements. So we do have a lot of creative activities within the course, not just meditation, metacognition, where we deep dive into short-term goals, long-term goals. We use the power of unconscious mind to unleash the potential, because a lot of times, this neuroplasticity or rewiring the brain is essential to tap and to break the self-limiting beliefs. And so we basically encourage and stimulate the growth mindset, which is definitely related to productivity and performance. Yeah.
Great.
And yeah, sure. And I also wanted to share with you, there are many resources. So this is our team. This is me, myself, Michelle. We also have Carolyn, who is a coach for parents whose kids suffer from mental health disorders. And Michelle herself is a parent coach. And we have developed a youth empowerment program. So if you go on our website, we have a free webinar for parents of youth. How we help specifically parents and also, of course, corporates, because a lot is happening, especially for children. They are in a very tricky state to keep a relaxed and calm mind, because they are not trained on meditation, mindfulness, metacognition in schools. Unfortunately, there's a lot of competition and a peer pressure, things that did not exist when we were growing up. So we cannot use the same parenting style. Scoldings and yellings, they do not work. They only jeopardize the problem. They may help in introducing a short-term terror to the child, but long-term they further diminish their self-esteem and self-confidence. And children need to know why and how to stay away from vaping, from drugs, and they need to know the accurate information. There's a lot of misleading information, which even adults are easily misled, that, you don't feel good, try cannabis, it's a magic cure for everything. And curious minds, emerging adults are really, really prone. They really don't know. They have shame and stigma in seeking help. And it's a very complicated cycle there. We have a lot of videos also, which you can access. A lot of Michelle's videos are on education, which would help parents. My videos are in general about what we have discussed, the ABCDE model that we have discussed. There are also videos on ant spray that we have discussed. Yeah. So this is in short, and on the home page you would find a lot of information about some of the strategies to boost your mental health, but definitely it's not everything. So please feel free to reach out to us. This is our email, info@transforming don't forget the hyphen, life.com, which you can also get from our website. And and then we would connect from there if you need any help for your employees, for your families, for your children. Yeah.
Great. Thank you so much, Sajita. This was great. Congratulations for such an amazing presentation. I would like to remind all attendees that this webinar has been recorded and you will be receiving an email, a follow-up email with the recording, and you can also watch the recording on our YouTube channel. You're receiving a lot of congratulations and thank yous. I join all these attendees who enjoyed this webinar just as much as I did. Thank you so much, Sajita. Thank you so much, Sajita. I really hope that the information that was shared here is very well taken by all our attendees. Thank you so much. Is there anything else you want to say, Sajita?
No, that's all. Thank you so much, Andrea, for arranging all this and to reconnect. I'm really grateful for this opportunity, and I really hope that it helps you to elevate your mood. Happiness is always within you. It's free. Please do not forget that. Create your own good, positive reality and spread this infectious, positive energy around you. You will see how your life will become heaven. Thank you so much.
Thank you all.
Thank you. Have a great day.
Thank you. Bye bye.
Bye.
Bye.